What's going on, everybody? Happy Tuesday. It is 5:30, and we are going live today for our week 2 of the Ask Me Anything series. I commented this morning in the Facebook group. I did not get a ton of questions. I do have a question that was posted earlier today on a different post, and then there's a question that I did not touch on last week. So we are going to touch on those couple of questions here. If you guys can jump on live, feel free to ask any questions that you may have. I'll make sure to take a look at those and try to do my best to answer those right now. If you guys are watching the replay here and don't see your question answered, and you have a question that you want me to answer next week, go ahead and comment that below. I'll take a look at that before next week's AMA and make sure to bump that to the top of the list. So let's jump in here. First question I got from last week that I forgot to answer, I'm sorry, Jenny, was about amino acids and protein. And I believe the question had something to do with, do proteins count as amino acids or do amino acids count as proteins? So if you want to back that up just a little bit, amino acids are the building blocks of proteins. So proteins are chains of amino acids, and what determines the type of protein, where it's used, and how kind of it functions in the body is dependent on the chains and the kind of layout of those amino acids. So amino acids are basically like ingredients in a recipe, and a protein is a recipe full of ingredients that are all put together in a specific way, right? So the way that the FDA classifies proteins for a calorie perspective, from a dietary and nutritional perspective, is based on the nitrogen content in the food. And so amino acids, because they're not combined and synthesized together in those protein chains, do not technically count as proteins from an FDA standpoint. However, amino acids are what proteins get broken down into in the body and get utilized in a very similar way. So when we look at proteins, proteins typically are either complete proteins, which means that they have all of your essential amino acids, or they're incomplete proteins, which don't have all your essential amino acids. So a lot of plant-based proteins are going to be incomplete proteins, which means that we have to start combining things together if we want to get that complete protein source. So proteins are going to be broken down slowly in the body. The stomach produces stomach acid. Stomach acid starts to denature those proteins so that we can start to break those down, and they get absorbed into the bloodstream as individual amino acids. They get stored in these amino acid pools, and then the body will pull from those amino acid pools within the blood as it needs to for things like protein synthesis. So when we're taking protein in its complete form in the diet, that's going to be kind of a slow absorption process. It's going to get broken down into individual amino acids. When we're consuming the supplement form of amino acids, that's going to get absorbed pretty quickly in the body. So they're going to act a little bit different metabolically. From a nutritional and the caloric density standpoint, proteins have 4 calories per gram, or 4 kilocalories per gram. Amino acids are still going to have calories, but because they're marketed as supplements and not the same regulation as something with a FDA nutrition label, they're not going to say calories on there. However, 5 grams of amino acids will still technically have 20 grams or 20 calories in it, because those amino acids can still get shunted through the Krebs cycle to produce ATP, which is your body's source of energy. So we can still technically get calories from amino acids. However, under normal circumstances, your body's not going to utilize those amino acids to burn them and convert them into energy. The body's going to use those for muscle protein synthesis. So what I'll typically do is I want to get my protein in during meals and protein shakes, things like that during the day. And a lot of times what will happen is during exercise, I'll take amino acids during exercise that are going to be absorbed quickly, so that as my body gets into that anabolic state and I'm trying to rebuild protein, I can start to then kind of fill in those amino acid pools, which your body's pulling from for protein synthesis. So to answer the question about proteins and amino acids, proteins are made of amino acids. Amino acids don't technically count as protein from an FDA standpoint. However, they do still have some caloric value, although it's not going to be the primary source of energy used, and amino acids get absorbed faster than proteins do. So we want to still get the protein in during the day. We want to get as many whole food sources of protein as possible, but amino acids can be a really great substitute, especially if we need that short, quick absorption for those amino acids and proteins. The next question was posted on an intro post today. Current health goal for this nice lady is to overcome parasites. Parasites we talked a lot about on the last AMA, so if you're watching this and you do have questions about parasites, go ahead and skip back to last week's AMA where we touched on all things parasites. how to correct high cortisone, and then lose weight and exercise more. So cortisone and cortisol are both produced in the adrenal glands, and they interconvert back and forth. I'm not sure if you meant cortisone or cortisol when you posted this. If you meant cortisone, cortisone is an inflammatory protein, so it's part of the healing response. So if you have really high cortisone levels, typically that's going to mean that we have a lot of systemic inflammation going on, and so we need to then support the inflammatory processes that are taking place in the body. There's a lot of different things that we can do. This is where having a full conversation about your past medical history and health and everything that's going on can give us a lot better understanding of what we need to actually take a look at in order to reduce those cortisone levels. If it's a high cortisol, now that's your stress hormone or one of your stress hormones. Cortisol should elevate and be high in the mornings and then gradually come back down in the afternoons and the evenings. So if we're dealing with high cortisol, that's a good thing in the morning unless it's super, super high. That's going to be the person that wakes up feeling super stressed, super anxious. If we have high cortisol levels at night, that's going to be someone who really struggles to fall asleep, anxiety in the evening times, things like that. So the best thing that we can do to support normal, healthy cortisol levels in the morning is actually work to reduce our cortisol levels in the evenings. And so things like meditation, breath work, getting adjusted even can be very helpful for reducing cortisol in the evenings. And if we want to increase cortisol levels in the morning, again, it starts with the evening, but getting out and seeing the sunrise first thing in the morning, getting exercise first thing in the morning, delaying our morning coffee intake by 60 to 90 minutes can all be very helpful at raising and then sustaining cortisol throughout the day. Of course, there's supplements that can help either drop cortisol or help increase or maintain cortisol levels, but we should never jump to supplements to fix our cortisol pattern if we're not doing all the correct things through lifestyle first. I've got a whole hour-long talk I did on cortisol and our stress hormones and how we can help to support stress in an increased or a decreased level. So if you're interested in that video, I can drop the link to the video in the comments below so you can click to that. When it comes to helping to support sleep, a lot of that is reducing cortisol levels in the evening. And I've got a whole video that talks about sleep and how we can support normal, healthy sleep patterns as well, which a lot of that comes back to that cortisol rhythm. If we're looking at something like a Dutch test, which does measure your cortisone and your cortisol patterns, that'll also tell us what that conversion looks like between cortisone and cortisol. And so based on looking at that, we can tell if your body's in this revved up fight or flight state, or if you're in this chronic inflammation state. So if we're dealing with a really high cortisone metabolism, typically that's going to be more of our autoimmune patients. And then it comes down to addressing what's happening within the immune response. And if we're dealing with this really high cortisol level, then that's of course going to be that stress response. And then a lot of that comes down to lowering stress at the correct times, increasing stress at other times during the day. The other component to this, the other question was lose weight and exercise more. So obviously exercise is super important. We want to make sure that we're exercising. What I always tell people is let's shoot for at least 20 minutes of intentional movement every single day. Exercise doesn't have to be this huge complicated thing. Obviously, depending on your goals, we can get very specific and fine-tuned with our exercise routine. But for most people who are just looking to support metabolic health and aging overall, we just have to take the first step, which is intentional movement. I've had people that are so afraid of exercise. My first goal was for them to literally just think about exercising for 20 minutes every day. Go in the garage and look at the weights that they've got sitting there for 20 minutes every day. And gradually over time, we start to build these routines and these patterns, and it gets easier and easier. So if you're trying to get into exercise, don't think of it as I have to be able to go to the gym for 45 minutes, or I have to go lift weights, or I have to go for a run, or whatever it is. Literally just start with some sort of intentional movement that can be going for a walk. It can be doing air squats. It can be sitting up and down off the couch or walking up and down the steps a bunch of times in a row. What it doesn't count, physical activity at work. And I have a lot of people who have physical jobs and always ask me, well, I don't exercise when my job's very physical. Well, the intention is not there to improve body health through exercise. So I always want there to be separate and segregated exercise or activity time. The other thing is that it doesn't have to be all at the same time. So we can break that exercise up throughout the day, because the reality is that exercise compounds over time. And so if I can do 10 air squats right now, and then in an hour from now I can do 10 push-ups, and then I can do 10 jumping jacks, and I can string together 10 2-minute intervals throughout the day, well, over the course of a week, I've done 50 2-minute intervals that I hadn't done the week before, and I'm going to be better as a result of that. So don't let the time constraint prevent you from getting into exercise. If it's a movement thing where your body's just not moving properly, well, then let's find a way that you can move. Most people can move in some way. And so let's just start there. Maybe we need to lose some weight or reduce inflammation. We can look at blood work, we can see what's going on in your body, and we can work to reduce those things to get you to a point that you can move better. And that goes into losing weight as well, because this was the other question that this woman had asked was, what can I do to start losing weight? And so there's a lot of things that can play a role in losing weight. From a very basic standpoint, it's an energy in versus energy out. We've got to create an energy deficit within the body. The caveat is that if we create too much of an energy deficit, then the body's going to go into this starvation or stress mode, and it's not going to allow you to lose weight because it's going to try to protect itself because it doesn't know when its next meal is coming. It doesn't know if it's going to have enough energy to support vital functions, so it retains that weight. A lot of people also struggle with weight, especially females, because of hormones, especially estrogen dropping as we go through menopause. Thyroid plays a huge role. Thyroid medication is one of the top prescribed medications in the country right now. And so most women either are taking thyroid medication, think they should be taking thyroid medication, or know someone who's taking thyroid medication. And if thyroid hormones are imbalanced, that can play a huge role in weight. Too much cortisol, too much cortisone also can affect weight. The other thing is that our body will store toxins in fat tissue. And so if our body's detox pathways are not set up appropriately, we're not going to be able to release that tissue because the body knows it's going to be releasing toxins into the body. And in that case, we've got to set detox pathways up first. And so if you're a female and you're trying to lose weight, I've got to look at what your energy balance looks like. I've got to look at what your cycle looks like. I've got to look at what your thyroid hormones look like. We've got to look at what your gut health is doing and what inflammatory processes are happening within the body. So there's a lot of complicated factors that can go into weight, which is why so many people just struggle with the diet and exercise thing, because the reality is that that doesn't work on its own for a lot of people because there's a lot of other complicating factors that are going on. Or people were told to do diet and exercise, but they don't have any idea what that means or where to start, and they just need someone to guide them along that path. And so we can look at all of these things. Again, that's where sitting down for a 40-minute new patient appointment is helpful, because we can have the conversation about what's going on, and then we can start to prioritize which of those things may be primary, and then where we need to start and how we can kind of walk through that pathway. So I hope that helps. Again, I didn't really touch on the parasites that, of course, can cause weight issues as well. I talked about that last week. If you guys have more questions about parasites and detoxes and cleanses and things like that, just drop it in the comments below, and I'll talk more about that on a future video. Stay tuned on my Dr. Connor Wolf YouTube page. I'm going to be dropping videos every Saturday as well, and I'm going to be reposting these AMA videos. Last Saturday, I posted a video all about creatine. So if you've got questions about creatine, if you ever thought maybe I should take creatine, or you don't even know what it's for, and if it could help you potentially, go check that video out on my YouTube. Again, that's at Dr. Connor Wolf, Dr. Connor Wolf. Hope this is helpful for you guys. My goal is just to educate people so that they can make the best health decisions for themselves and their families. So if you have questions, things that you're struggling with, or things that you want help with, feel free to drop it. I want to be a resource to you, and I'll be more than happy to talk or answer questions on here in the future. So we'll see you guys next Tuesday at 5:30.